The United States, one of the richest nations in the world, long seen as a symbol of progress, convenience, and advanced medical science. Yet behind that polished image lies a silent crisis that has been unfolding for decades and continues to worsen. That crisis is obesity. According to recent health statistics, more than 40% of adults in the United States are obese. This is no longer a warning, it is a harsh reality. In simple terms, at least 4 out of every 10 Americans are carrying excess body fat beyond safe limits, leading to serious consequences for health, the economy, and society as a whole. Even more concerning, obesity is no longer limited to adults. Children and teenagers across the United States are increasingly affected. Millions of children are overweight from a very young age, placing them at high risk of heart disease, type 2 diabetes, and other chronic illnesses later in life, or even during adolescence. So, how did a highly developed nation like the United States fall into such a severe obesity crisis? One of the most obvious causes is diet. Fast food, processed meals, sugary drinks, and products high in sugar, salt, and saturated fat are everywhere. They are cheap, convenient, easy to access, and aggressively marketed through television, social media, and entertainment platforms. In the US, just a few dollars can buy a meal containing more calories than the body needs in an entire day. Meanwhile, healthier options such as fresh vegetables, fruits, and organic foods often cost significantly more, making balanced nutrition difficult for many low-income families. Beyond diet, a sedentary lifestyle plays a major role. Technological advancement has brought comfort and efficiency, but it has also reduced physical activity. Many people spend hours each day sitting in front of screens, computers, phones, and televisions, while movement and exercise become increasingly rare. Children today spend more time on video games and social media than playing outdoors. In many neighborhoods, a lack of green spaces and safe playgrounds turns physical activity into a luxury rather than a daily habit. Another overlooked reality is that obesity in the United States is closely tied to social inequality. Low-income communities, people of color, and those with lower levels of education tend to have higher obesity rates. They often face limited access to healthy food and lack sufficient education about nutrition and long-term health. The multi-trillion-dollar food industry also plays a significant role. Many products are engineered to be addictive, triggering cravings and encouraging overconsumption. Sugar, salt, and fat are carefully combined to create irresistible flavors, but at the cost of long-term health damage. Obesity is not just about appearance. It is a major risk factor for serious diseases, including heart disease, stroke, high blood pressure, diabetes, cancer, and mental health disorders, such as depression and anxiety. Life expectancy among obese individuals tends to be lower compared to those with a healthy weight. The U.S. healthcare system bears a massive burden as a result. Every year, hundreds of billions of dollars are spent treating obesity-related conditions. These costs affect not only individuals, but also the national economy as a whole. Perhaps the most frightening aspect is not the statistics themselves, but the normalization of obesity in American society. When excess weight becomes common, it stops being seen as a serious problem, and it is this collective indifference that allows the crisis to continue growing unchecked. The consequences of obesity in the United States extend far beyond individual health and deeply affect society as a whole. A less healthy workforce leads to reduced productivity, increased sick leave, and rising insurance costs. These factors directly threaten the country's long-term economic growth. For children, obesity leaves not only physical damage, but also deep psychological scars. Many face stigma, bullying, and body shaming from a young age. These experiences can follow them throughout life, affecting self-esteem, social relationships, and mental health. The U.S. government has implemented various measures to address the obesity crisis, including improving school meals, promoting physical activity, and requiring clearer nutrition labels on food products. However, the results remain limited, as unhealthy eating habits and sedentary lifestyles are deeply embedded in modern culture. One troubling paradox is that the United States possesses some of the world's most advanced nutritional science, yet it remains among the countries with the highest obesity rates. This reveals that the issue is not a lack of knowledge, but rather how society functions, how food is produced, marketed, and consumed. The obesity crisis in the United States serves as a powerful warning to other nations, especially developing countries. As living standards rise and fast food and modern lifestyles spread, obesity rates tend to increase as well. Without early prevention, many countries may follow the same path. Solving this crisis is neither simple nor achievable through individual effort alone. It requires coordinated changes in public policy, education, urban design, food systems, and personal awareness. Each individual must understand that health cannot be bought with money. Choosing nutritious foods, maintaining regular physical activity, and building a balanced lifestyle are essential steps in protecting oneself from the growing obesity epidemic. The story of obesity in the United States is not just an American story. It is a global warning about the cost of trading health for convenience and uncontrolled consumption. If no action is taken today, these alarming statistics may become the future of many other nations. And the price to pay will not only be financial, but the quality of life and lifespan of entire generations. The shocking truth about obesity in the United States is not meant to criticize or judge, but to remind us all of a fundamental reality. True progress is not measured only by economic growth, but by human health. And once health is lost, nothing can truly replace it.